This is Dr. Aditya Varman speaking from Uma Eye Clinic, Nagar, Chennai. In this video, we are going to address a new form of laser vision correction which is called Presbyond. So if you have seen our previous videos, you would have learned about laser vision correction and you would have seen us talk about SMILE and its advantages and how it can correct your vision and give you a glass-free, clear vision. So what exactly is new in this new treatment known as Presbyond? So as you are aware, the lasers, which is known as SMILE, which we have spoken about before, it corrects your distance vision, which means if you use a glass to look at far objects, you have to go outside to drive, you're looking at TV, looking at a blackboard, etc. That SMILE laser vision procedure corrects your glass power for distance viewing. So after the age of 40 or 42, all of us do develop what is known as presbyopia. Presbyopia is an additional reading power that is going to come to all of us because as we age, the muscle in the eye loses its strength and we have to use an additional glass to look at things at near. Which means when you look at your newspapers or your phone or your screen or your laptop, you have to wear an additional reading glass after the age of 40 or 42. So this is what we call as presbyopia. So what exactly is the age criteria for this laser? So as you know, for the SMILE laser, we just have a lower limit. There is no real upper limit. The lower limit is 18 plus. After the age of 18, anyone can opt for the SMILE laser. After the SMILE laser is done for a patient, they will have clear vision lifelong for distance. But around the age of 40 to 42, of course presbyopia is going to come and then you do require a reading glasses. So if you are a patient over the age of 40, and you're already wearing a glass of distance and you're now having a reading power as well, Presbyond is the treatment for you and will be the best option to give you glass-free vision. So what exactly do we do in Presbyond and how is it different from the other forms of laser vision correction? So what we do in Presbyond is we do a comprehensive testing for a patient before we can tell them that they are eligible for this laser. So in Presbyond, we correct one eye for distance and one eye for near. Just like how all of us have a preferred hand of dominance, that is, some people are right-handed, some people are left-handed. We also have a dominance of the eyes, means some people are right eye dominant, some people are left eye dominant. So in this Presbyond test, we first check which is the dominant eye for a patient. And once that is checked, we then go ahead and do a simulation testing, which means we show a patient how exactly this Presbyond laser treatment will work. We correct the dominant eye to see very clear at distance for far activities, and we correct the non-dominant eye to see very clear for near activities, that is for reading, writing, looking at the phone, etc. So we do the simulation testing and we test if a patient is accepting this Presbyond test. Usually 97% of patients do accept this Presbyond testing. Once they pass this test, we go ahead and we do a cornea exam. The cornea exam is called topography, which is what we do for all patients who are going to go ahead for a laser vision correction to ensure that it can be done safely on their cornea. After both of these exams are done, we go ahead and we do the Presbyond laser for that patient. So what exactly can you expect in the early visual period after the Presbyond laser? So after the Presbyond laser is done, in the early period, you will have good vision. You will see distance clearly and you will see near clearly as well. But there is a learning phase of 3 months. This phase is called neuroadaptation. That is, the brain is now learning to see clearly with the dominant eye for distance and to see clearly with the non-dominant eye for near. So during this adaptation phase, for the first 2 or 3 months, you might have some difficulty for certain activities. Some patients will have some driving difficulty when they go out and look into distance. Some patients will have some near difficulty when they're looking at a screen or a laptop. So during certain activities, about 10 to 20% of activities after the Presbyond laser, for the first 3 months, the patient might have to wear temporary glasses to ensure they are comfortable to do certain activities of their lifestyle. For the first 1 month is the learning phase, and then second month the learning gets a little better and the patient will not have to wear glass as much anymore. The third or fourth month onwards, patients will not have to use any more glasses. So this is what we must first understand about this Presbyond laser. After about 3 to 6 months, usually 90 to 95% of patients are comfortable. They'll never have to wear glass again. But there are some about 5 to 10% of patients who still say they have some difficulty for some activities. For such patients, we determine what activities they have difficulty in, whether it is distance or near, and we do offer them a touch-up procedure to ensure that those difficulties are solved. So this is a nuance of Presbyond. So now you can now ask me, what exactly is the selection criteria? So 1, you have to be over the age of 40. Number 2, you should not have any cataract. So these are the 2 basic eligibility criteria. And 3, you have to pass the Presbyond test. And 4, your cornea scan should be all right. So once all of these are in place, you will be a candidate to undergo this laser. So this Presbyond laser is the most safe, effective and efficient way to correct your vision over the age of 40 when you have both your distance vision problem and your reading problem as well. Yes, of course, if you don't have any distance glasses and you only have reading glasses, only the reading power as well can be corrected with the Presbyond treatment. So now you can ask me another question. Is it possible to do the Presbyond laser if you do have a cataract? Let's say there's a patient who is over the age of 60. They do have a cataract and they do want to have the Presbyond laser. If they have the early stage of cataract, yes, we can still go ahead and do the Presbyond laser for them. But if they have the later stages of cataract, it's not very advisable to do the Presbyond laser. We will rather opt them to undergo a cataract surgery and we place a multifocal lens in their eye to ensure they don't have any glass for any distance. But let's say a patient is 60 years old, they do not have any cataract and they are eligible candidates for the Presbyond laser. Yes, they can go ahead and get the Presbyond laser done and they will have glass-free vision throughout the rest of their lives. What happens when you do the Presbyond laser and then a patient develops cataract about 5 or 10 years later? This is not at all an issue. If this is the case, we can go ahead and do the cataract surgery. We place a monofocal lens in the eye, and after the cataract surgery is done, the patient will still retain their Presbyond advantages many years into the future, and they can still be glass-free after the cataract surgery is done. So all in all, the Presbyond treatment is the best option for patients over the age of 40 years who are seeking a solution to be free from glasses for all distances of vision. I hope this has given you a brief understanding of this novel treatment. If you have any further questions, please do drop them in the comment box below and I will be happy to answer. Thank you.